Good afternoon, and thank you for joining our Common Denials presentation. I am Carolyn Smith, Field Rep for Territory 3. My co-pilot today is Janie Griffin. She is one of the hospital reps. This presentation, along with each presentation from today, is available on our website at www.mmis.georgiaspelledout.gov. From there, select provider information, provider notices, and then each presentation is listed. The agenda for today is we will go over member eligibility and the importance of checking member eligibility, when and when not to bill a member, some of our more common eligibility denials, Medicare Part B, deductible greater than the yearly allowed amount, the charge disallowed by Medicare, billing rule not found for billed procedure, Medicare allowed paid amount is missing or zero, diagnosis not allowed for date of service, secondary diagnosis returned from grouper denial, admit date doesn't equal the from date, contract invalid rev code procedure code combination, procedure not allowed for the date of service, exact duplicate, and then we will go over what you need to know as far as locating banner messages, provider notices, and the Georgia Medicaid manuals. Members eligibility. Part 1 Policy and Procedure Manual. The division established eligibility criteria for Medicaid Peach Care for Kids. The benefits is based upon federal regulations. Eligibility criteria for major coverage groups are also in Part 1 Policy and Procedure Manual. Please note, it is the responsibility of the provider to verify Medicaid Peach Care for Kids eligibility on each date of service. We cannot stress that enough. Please, please, please take the time to verify the member's eligibility prior to rendering services. And again, just to reiterate, conditions of participation is found in Part 1, Chapter 100, Section 106. As general conditions of participation, all enrolled providers must accept the division's payment as payment in full for covered services to patients accepted as Medicaid or Peach Care for Kids members, deduct all payments for covered services received from third parties or other insurance plans from the amount billed to the Division of Covered Services rendered, and notify the division regarding the existence of any other insurance or third-party resource unless billing for managed care copayments. You have to agree not to seek or accept any payment whatsoever for covered services from the member or other interested party when the member was accepted as a Medicaid or Peach Care for Kids member. And lastly, not seek reimbursement from the member or other interested party from claims submitted to the division for which payments subsequently are denied, reduced, recouped, or refunded due to the provider's failure to comply with the divisional policies and procedures. How to verify members' eligibility. The eligibility tab is on the secure side of the portal. So please, please, please enter your username and password and your authenticator. Once you're on that tab, select eligibility and then eligibility request. There are several combinations that you can use to verify members' eligibility. You can have the member's Medicaid ID number and the date of service span, the last name, first name, the gender of the patient, the date of birth of the patient, as well as the date of service span, the date of birth of the patient's social security number, and the date of service span. And lastly, the last name, first name, social security number, and date of service span. Some of the more common eligibility denials that we see are Edit 2003. That means the member is ineligible on the detailed date of service. This edit is triggered when the claim detail dates of service do not fall within or are equal to the beginning and ending dates of any recipient eligibility segment. Member ineligible on detailed date of service, if you verify the eligibility, it shows you that the member is either active or inactive. So please get in the habit of checking that eligibility. Edit 2078 and 2077 means the member has partial eligibility for detailed date of service. This edit is triggered when only partial eligibility was found on the detailed date of service. Edit 2017 and 2019, member services are covered by CMO plan. So this edit is triggered when a member has a lock-in segment with one of the CMOs, whether it is Amerigroup, Peach State, or CareSource. The screenshot at below shows you a benefit plan for a member. It shows that the member is active. It shows you the effective and end date, and then it also shows you the eligibility service type. The next screen shows you if the member has a managed care. Under the managed care subtopic, it shows which managed care the member is currently enrolled in. And these are just screenshots to show you what it looks like in GAMIS once you log in. Edit 6704, Medicare Part B deductible greater than the yearly allowed amount. This edit is triggered when the member has met the yearly deductible amount. The 2023 yearly deductible amount is $226. Your method of correction: verify the provider number, member ID, date of service, diagnosis code, and please check and also double check to ensure that the Part B deductible amount has not exceeded that limit of $226. And if you have any issues with that, please reach out to your provider service rep. Edit 3381, charge disallowed by Medicare. This edit is triggered if the Medicare allowed amount is equal to zeros and the claim type is B. Please check, your method of correction. Verify that your provider number, member ID, date of service is captured correctly. Please double check to ensure that the Medicare allowed amount is entered based on the information on the Medicare EOB. No crossover coinsurance or deductible is due, and 3381 usually go hand in hand. Charge disallowed by Medicare. So please double check those Medicare EOBs and make sure that you're billing that information based on the way that you submitted it or Medicare paid it. Edit 4801, billing rule not found for billed procedure. This edit is triggered when there are no billing rules for the procedure under the provider contract for the date of service and GAMIS. In edit 4871, claim type restriction on procedure billing rule. This edit is triggered when claim type is not within the claim type restrictions of the billing rule for the procedure code and GAMIS. Method of correction: please review the Part 2 program-specific manual to determine what codes are billable, and also check the procedure search panel to determine the billing rules for the procedure code. The procedure search results will show the applicable category of services, associated modifiers, claim types, age restrictions, and if a PA or pre-cert is required. Once you review this information, submit or resubmit your claim. Procedure search panel. You do have to be logged in on the secure side. So providers are able to look up the procedure codes on GAMIS's web portal. The information contained on this screen, it includes a short description of the procedure code, the effective date of the procedure code, category of service, modifiers, and if there are any prior authorization requirements. Just to show you where to go, select providers and then select procedure search. Enter in your procedure code, your place of service, and your procedure code date of service. And the results will return as this. Please pay attention to the category of service that you're currently logged in as, because those are the results that it's displaying for. So for example, on this screen, the provider is a category of service 430, physician. And on the left-hand side, you see the category of services that are listed. 430 is listed with a claim type M. No prior authorization is required. Shows you the modifiers that can be billed with it, as well as the effective date for the procedure code. I will now turn it over to Janie Griffin.
Thank you so much for that, Carolyn. Bear with me 1 minute while I get over to the screen. Okay, so we are now going to start with a couple of the other denials that pertain to hospitals. So the first one we're going to talk about, and it's a twofold thing to where it states diagnosis not allowed for data service, and the edit codes for that will be 4027 and 2925. With this denial, Medicaid inpatient claims are reviewed in the system based on the date of admission. Therefore, all inpatient claims submitted should have the diagnosis effective on the date of admission. However, if this is a crossover claim, this is an exception to the rule that is processed. I'm sorry, hit the wrong. For Medicaid claims, we process these claims according to the date of admission. However, Medicare claims are processed according to the date of discharge. So as I stated previously, Medicare crossover claims have that exception. So they have to be billed just as Medicaid. We've provided for you a couple of examples here as well. And if you recall, when I stated this was a twofold denial. So based on the screen that you see now, this is a Medicare crossover claim, and the denial added on this one is 4410 and 4414, which is stating secondary diagnosis is returned from grouper. If you notice, the from and through dates of service on the claim is September 27th through October 1st of 2022. Remember when I stated that claims are processed according to the admit date. So that is when the claim would be processed based upon September. The screen that you see now are the screen that basically has the denials. Your edit codes, diagnosis not allowed for dates of service, secondary diagnosis invalid return from grouper. You see it on the error list as well as your EOB list. And here is where we have the codes that was submitted on the claim. The code that's kicking out on this claim is I-31.39. When you look at that, that code is kicking out because it became effective October 1st of 2022. And your dates of service again, the admit date was in September. So the method of correction for this would be all diagnosis codes for inpatient claims must be valid on the date of admission. The next claim I want to talk about a little bit pertains to admit date does not equal the from date of service. The edit codes are, as you see, 517, 518, and 59. This edit is triggered when the admit date is not the same as the from date of service on the claim. So you see your dates, you see, I'm sorry, not the dates, but you see the denial edit code showing here. On this claim, you see that the services that are listed is for 310 of 23. The admit date is 312, so the dates are different. On this claim, you also see your charges. With these charges, you see that the member came in through the emergency room. Upon them coming from the emergency room, which is the revenue code of 450 that you see. Let's say Dr. Brown decided to keep him for observation for a couple of hours just to see what would happen. That is where the revenue code of 762 comes in. Okay, and then after that, Dr. Brown decided to admit the patient. So this is how they became an inpatient. Your method of correction for these type of claims would be for a straight Medicaid claim, the from date of service must match the admit date of service. Your revenue code of the 450 And the observation code of 762 will identify the prior dates that was prior to admission. So you as a provider, you would submit your DMA 520, identify your ICN number to state that it had denied for the admit date does not equal the from date of service, explain what it is, we will review it, and then send your claim back to request that the denial is overridden. The next thing I want to talk about pertains to contract invalid Rev code procedure code combination. This edit is triggered when the revenue code and the procedure code cannot be submitted together. So some providers think that this means that these rev codes and or procedure codes are not valid. However, they are. Both of them can be valid. The denial edit is telling you that they cannot be billed together. That's why you see the combination that shows there. Okay, so you see your edit codes. When you receive those type of denials, you can either do one thing, which would be submit the claim over as a CTN or the DMA 520 to ask which code it is that's denying, or you can submit it back to your medical records department and let them look over that. Okay, and once they look over it or once we respond back to you, we'll be able to identify exactly what it is. So as you see here, the denial edit code is J0840. You see your denial edit as well. What you as a provider would do is utilize the procedure search panel. Ms. Carolyn went through that with you. And on the procedure search panel, once you enter the procedure code in there, enter your place of service or your category of service, your dates of service, all the required information. Once that has been submitted, then you should be able to see if your category of service is showing under the category of service location. So if you recall, this is an outpatient claim with the category of service 070. However, you are not seeing 070 under the provider contract, which would indicate that this procedure code is not valid or not allowed for your dates of service. Exact duplicate. There are multiple reasons claims deny for exact duplicate, but this is one of them that we really needed to go over with the providers to make sure that you had a better understanding as to how these go. So this particular denial edit code is 5647 and 5190. This edit is triggered when multiple claims are submitted for the same date of service. I need for you to pay attention to the date of service, which is 5/10 of 22. The total amount billed on this claim is $225. You see your procedure codes that's listed here as well. So this is the denied claim. Okay, and with that, you see your edit codes that's showing. You're also looking at the diagnosis code on these claims as well, because you have to keep in mind it's denying for an exact duplicate. The claim that it's denying up against is this one that you're able to see now. Your dates of service are the same, 5/10 of 2022. That is what prompts it to be an exact duplicate denial. However, the charge amount on here is more, is $789. Your codes are totally different, as well as the diagnosis. So you as a provider, you have multiple ways to have this done for a method of correction. You can verify to see if the member was seen at your facility multiple times on that date of service. You need to verify if the services provided are diagnosis related. And if it turns out that they are diagnosis related, then you need to submit one claim with all of the charges. So it would be the first claim as well as this one that would be together. Okay. And if they are not diagnosis related, then that is when you need to submit the DMA 520 or create the CTN. Please note that if you're going to submit the DMA 520, you have 30 days from the date of the denial to submit that over. Okay, we're going to talk a little bit about what you need to know. So at this time, we have multiple providers that have new staff members coming on, and they'll create a CTN or they'll send an email, and during that email, they're asking questions that pertains to the system with navigating through the system. So we just want to go over a little bit of that with you. And if you attended the first morning session, this was talked about a little bit, but we just want to make sure that you are understanding exactly where everything is as well. So on the Gamut site, you have multiple selections available. We're going to start off with the provider messages. Exactly what is it that is in provider messages? And this is the communication when you are not seeing your rep or when you are not attending a Medicaid fair or a Medicaid workshop or any type of communication um, face-to-face that we have with you. This is where you need to go. Okay, so let's talk a little bit about your provider messages and exactly what is there. With the provider messages, these are your banner messages. This is the communication again that is available for you when you are not seeing us, or if new things come about before you're seeing your rep or before a Medicaid fair. This is your communication. And it's always good to go out there. I advise my providers all the time, at least once a week, go out there and see what we're talking about. As you're looking at this screen, you see there's a lot of information for Medicaid renewals determination beginning April 1st. Okay, so again, this is the communication for your messages. Okay, and these are others that is there as well. This is with your provider notices. So your provider notices are the presentations that we do. These are presentations, again, during the Medicaid Fair, during your workshops, webinars, things of that nature. Everything is right here. You see the presentation that's already posted for end of continuous enrollment. You see the hospice service presentations and so forth. Everything is housed here for a presentation. So should you miss the Medicaid Fair or someone from your team miss the Medicaid Fair, this is where you need to go to pull that presentation. Okay? Your provider manuals. This is really important for you all because this is where all of the things are housed that pertains to the way that we process, how you need to submit claims, what we are in compliance with as far as it goes with DCH. All of your manuals are housed on this page. Just want to reiterate a couple of things. When you're working your denied claims, these are a couple of claims management tips. Reviewing, correcting, and resubmitting denied claims is central to your revenue management team. Assign dedicated staff persons to denials if possible. Document the receipt of your denials, reasons for the denied payment, and deadline for resubmission. Always review your denial reasons. We're still looking at where providers will resubmit a claim, resubmit a claim, resubmit a claim. However, there's nothing that you're doing to correct it. So read your denial. Read it once, read it twice, and act at that time. If you're not making any changes on it, then nothing is going to happen differently with it. Okay? So once you look at that denial, if there's any corrections that need to be made, make your corrections involving the missing information or inaccurate information. Review your clinical reasons for the denial, the services, the diagnosis with treating the providers, etc. Make any corrections possible. But one of the most important things that I stress to providers is resubmit your claims in a timely manner. You all are familiar with that. If you're not, then go to the Part 1 policy manual to where we're talking about timely filing. Remember, denials review delay as well as reviewing loss. So at this time, we're hoping you should now know the importance of checking members' eligibility, when and when not to bill a member, how to correct eligibility denials. You should know how the Medicare Part B deductible greater than yearly amount is worked. You should know about the charge disallowed by Medicare, what to look for on claims that deny for diagnosis not allowed for the dates of service or the diagnosis returned from the grouper. The date of admission through date of discharge is really important. You should now know how to verify the admit date doesn't equal the from date. And you should now be able to communicate to your medical records department and your charge masters department for the claim denials that talk about revenue procedure code combo. Go back and tell them, according to Medicaid rules, revenue code 510 cannot be billed with procedure code 99234 or however that may go, and ask them what would be a valid code. You should now know how to utilize the procedure search panel for a procedure not allowed during the dates of service, or what to look for when your claims deny as exact duplicate. And most importantly, you should understand and know the importance of reviewing your banner messages, your provider notices, as well as going to your provider manuals. The screen that you see here is the screen where we're talking about the different color-coded territories. As you all saw or heard this morning, this screen here talks about your field service representatives based on the territories and their regions. We are once again introducing you to our statewide consultants. With the IVRS Overview system, this allows users to call and conduct inquiries or transactions on the Georgia Medicaid Management Information System. Using a touch tone telephone, real simple. You got your 1-800 number and you have options that you can select instead of just holding the line. If it pertains to claim status, select option 2. If it pertains to your prior authorization, select option 5, and so forth, and you will be able to get the assistance that you need. Our provider services contact center can be reached at the 1-800 number that you see here. We are available to you from 7 a.m. to 7 p.m., Monday through Friday. We do not work on holidays nor weekends. However, the web portal is available to you 24/7. And at this time, we will conclude the presentation. We would like to thank you all for taking our time to be here to attend it with us. And if you have any questions for us, we are now ready to answer them. Ms. Sharita, are you all seeing anything? Okay, so I'm not sure if you all are able to type. I see Shay Minnick. You can unmute yourself to ask your question.
I submitted a question in writing, but I'll go ahead and ask it now. I'm a children's intervention service provider, and for a lot of our treatment codes, we get
Shay, are you able to unmute?
Yes, I am unmuted as best I can tell. Let me check.
Go ahead, Shay. We can hear you.
Oh, you can hear me now?
Yes.
Okay. I had submitted a written question, but I'll go ahead and ask it real quickly. I'm a children's intervention service provider. And so most of our treatment codes, we get 8 units authorized per month without an actual pre-authorization needed. And I'm just wondering if you by chance know how the program determines whether or not we need an authorization on a specific claim. Our items are going through an EDI, and I'm trying to unravel how to apply the authorization number to which treatments, since we get the first 2 in the month, for example, that we don't need the authorization, and then the second 2 of the month we do, because we're doing 4 units each visit. Do you have any idea what the methodology that's being used for determining when they're looking for the authorization number?
Okay, Shay, I apologize for that, but I'm going to need you to repeat your question again for me.
Okay. As a children's intervention service provider, we get 8 units without an authorization for treatment, and we typically use 4 units per week. And so what's happening is our claims are going through the EDI process, and sometimes a date of service in the first half of the month that does not have an authorization number on it gets denied, stating it needs one. And then in the second half of the month, where we're putting the authorization number on it, it's getting denied, saying it doesn't need one. So we're playing this put it on, remove the auth number game, and I'm trying to get our end set so that it will go through smoother. Do you have any idea what criteria they're using as far as does it need the auth number for this claim?
The first 8 units will not need the prior authorization. Anything after that does require the prior authorization to be billed on the claim. But I am going to say, Shay, I would highly encourage you to submit a contact us, so that your field rep will be able to either do a virtual with you, or May 11th, come out to your office and let's discuss that and look over that. But the first 8 will not require your prior authorization. So that claim, or those 2 claims, should not be billed with the PA. Anything after that should be billed with the PA.
Okay. And what I'm seeing as far as the billing cycle goes, it seems to cut off on Tuesday for what's processed on Friday. Is that correct?
That's incorrect. Claims have to be in by Friday at noon in order to be on the
For
next.
that Friday processing, or for the next week Friday?
If you have claims submitted by noon on Friday, noon tomorrow, let's say noon tomorrow's
Yes.
Friday, they will be on next week's remittance advice.
Oh,
Yes.
okay. That will help, because I'm
Okay.
trying with our EMR to put the authorization number only on the second half of the month claims.
Okay.
That will help us unravel. Thank you.
You're certainly welcome. But again, please submit a contact us for your field rep so that we can take a look
Okay.
at those claims for you.
All right. Thanks.
You're certainly welcome.
Okay, do we have any more questions, hands being raised so we can address them? Leanne, I see your hand. You may unmute yourself at this time, please.
Hello, can you hear me?
Yes, ma'am.
So I have a question. I am in children intervention services as well. And my question pertains to the plan of care that you have to send in. And the problem I'm having is sometimes the doctors take more than the 30 days to sign and return the plan of care. So I've had a couple of denials when I've sent it in, and the doctor has signed it 30 days after my provider has signed it. How do you remedy that? Because I'm kind of lost on what to do next, because I was denied because the doctor took longer than 30 days.
Okay, you want to speak on that?
Yes. Give me 1 second. The doctor has to sign within those 30 days. If he signs it, if I remember researching this in the Children Intervention Services Manual. If he signs it after the 30 days, the plan of care is still valid for those 30. I'm gonna have to do some research on that one for you.
I was thinking that, when I submitted it, and I knew that
Mhm.
he had signed after the 30 days,
Okay.
and my request was for after when he started the plan of care, after when he signed the plan of care,
Mhm.
but my request was still denied because of that.
Okay. And once it was denied, did you reach out to Alliant Health Solutions to get a valid reason?
I submitted a question, but I didn't get a response back.
Okay. I would encourage you to follow back up with Alliant Health Solutions, because they would determine why, or they would be able to tell you why that prior authorization was not approved.
It said it. I mean, it told me like when it was denied because of that.
Because the doctor didn't sign it within the 30 days?
Yes.
Okay. So,
Can you send over your ICN number and we can review that, or would you prefer?
She's like,
Yeah, but go ahead and send in the ICN number so it can be reviewed. And if it's something we need to discuss with the Lion Health, we would do that. Just make sure on your CTN you're providing the contact information for us to reach back out to you.
okay, so where do I do that? You want me to do that and again,
Create the CTN. Are you
okay.
Yeah,
Yeah.
once you create the CTN, hey, this is the ICN number we discussed in reference to the PA that was denied, and give the authorization.
Okay. Thank you.
Okay, do we have any other questions?
Looks like Shay has her hand raised again. Shay, do you have another question?
I apologize for jumping in again, but I have a solution for Leanne because I also do children. When the doctor signs after that 30 days, we make a copy of our care plan, we re-sign it, and I have a pretty ugly letter that I send to the doctor saying that you missed the 30 days per Medicaid rules and this child has been put on hold because of you. And we usually get our signatures within 24 hours then.
Well, thank you, Shay, for the information.
Thank you.
Thank you. Thank you, Shay. We appreciate that.
You're more than welcome.
Okay, Christina, do you have a question? All right, Angela Patterson, you can go ahead and unmute yourself and ask your question. Angela, are you able to unmute yourself? All right. All right, ladies, it looks like we don't have any more questions. Well, hold a second. Christine, are you able to unmute yourself? If you can't unmute yourself, please type your question in the Q&A panel and we will try to answer it.
Okay, Miss Angela, you want to try yours again to see if you're able to speak? Okay, Angela, we see your hand raised. Are you able to unmute yourself or either type your concern into the QA panel?
Can you hear me now?
Yes, ma'am, we can.
Sorry about
Hello,
that.
Miss Patterson.
Hello. Thank you for being patient. My question is, I'm having a couple of claims that are Medicare, Medicaid, and they're old dates of service dating back to early and mid 2022, where Medicare has like recently paid, like in the last couple of weeks. So crossing those claims over or getting those claims to pay with Medicaid secondary are being denied for untimely filing. What is it that I need to do to get past that?
Process of elimination. Your claims are denied for timely filing due to the dates of service.
Correct.
So what you would have to do is take that extra step and attach all of your EOBs with the claim to show that Medicare, just recently processed the reimbursement on their end.
So
Now, let me ask you, are these CMOs, Medicare Advantages? I'm sorry.
some some of them are, but some of them are traditional Medicare too, because I do look at those.
Okay, so just when you submit those over to us, because normally if it's traditional Medicare, Medicare is aware that the member may have the Medicaid, so it will cross over to us accordingly as a 20 ICN number. However, if it doesn't cross over from them, then always do your process of elimination. Upload the EOBs with the claim, and that has the date that they processed them. So your claim will go into suspense and it has to be reviewed manually.
Okay, so I can resubmit the claim through the web portal with the Medicare recently paid attachment.
Yes, ma'am. That EOB will
That EOB, yes.
justify the timely filing.
Okay. Okay. All right. All right. I will do that. Thank you.
You're welcome.
All right, Anisha Jones, you have a question. Please unmute yourself. If you can't unmute yourself, please type your question in the Q&A panel.
Okay, and I saw Miss Christine's hand.
Yes. Can you hear me now?
Yes,
Yes.
ma'am, we
Oh,
can.
great. I couldn't type or unmute myself. I don't know. I have a few questions. First, I want to ask you, well, thanks for doing this because I'm actually learning a lot. I had a question. I wanted to know for the Medicaid redetermination that's going on, do we have to keep checking on them?
Every time a member walks into your facility, and irregardless of it being redetermination or anything, if a member walks into your facility for any type of service and their insurance pertains to Georgia Medicaid, you should always check eligibility.
Yeah, I know that. I know that there were some of them that did not renew for April. So do we have to go back and check it up until like June, maybe?
You're gonna check it every time they
Yeah,
come.
every month. But I
Yes.
know that there's some of them that are inactive right now, and they're not being offered, I guess, extra coverage or another option. They just didn't renew, I guess, for April.
Okay, so what you're saying is are you saying based upon the member themselves
Yes.
to where they didn't renew it?
Yes.
And you're trying to figure out what would your next step be?
Yes, because I guess they're
I-
just inactive and they have a different coverage altogether. Is that right?
If they're not showing as eligible in our system, then we can't tell you if they have another type of
Okay.
coverage at all. It may be, that they could have, just gotten another insurance or something,
Yes.
but for Georgia Medicaid, it would not be covered if it shows
Okay.
not active. And there's um, no other mechanism that I'm aware of where
Okay.
you would be able.
Okay, so my other question was for DMAs, per calendar year, I know that the number of units, sometimes I think it goes to 8 visits before they need a DMA, is that correct?
What do you mean DMA?
The prior authorization where they get a number of visits per year and then a DMA is submitted?
DMA 81 is what you're referring to?
That's correct.
Yeah, they have 10 visits. Anything after that requires a DMA 81.
Okay, so if that number at the bottom where it shows the visit says 10, we request a DMA.
That's correct.
Okay.
In order for
And
them to
then-
get additional units.
Sure.
I'm sorry, additional office visits.
Okay, got it. So for the DMA that needs to be processed, if they are seeing the doctor and the nurse, do you all need 2 DMAs or just one for the provider?
Is based on the rendering ID number.
Okay. So if the patient is seeing a nurse today, but they usually see the doctor, do you still need 2?
They're seeing a
DMAs?
nurse for an office visit?
Like a nurse practitioner.
Okay. Then yes.
Okay.
Has to be
Yeah.
per rendering ID number.
Sure. So my last question was, is there a list of codes that are considered inactive, like code number 661 and those kind of codes that it means that they are inactive? They only have maybe dental or something?
You're talking about the aid categories?
Yes.
Yes, those are in Part 1 Policy and Procedures Manual.
Part
1 Policy and Procedures Manual on our website.
Okay, and procedures. Thank you guys so much.
You're certainly welcome.
Okay.
Okay, Christine, we still see your name, Christine. Do you have a question? Can I unmute yourself if you do?
No, I just lowered my hand. It should come off. Thank you.
Okay.
Guys.
All right. My Doug, you can unmute yourself and ask your question. All right. Anisha, if you're able to unmute yourself, you can go ahead and unmute yourself and ask your question. All right, we'll move on to Anita Oliver. If you're able to unmute yourself, you can do that and ask your question.
If you all are having trouble unmuting yourselves, try to type your question into the Q&A panel, please.
Okay, so Anisha, you're saying these questions are related to SNF billing, seeing a lot of MSRP denials when billing room and board claims. If the billing office bills telehealth/community services for a resident that are admitted in SNF, so room and board claim will not pay, is there an appeal process to show residents was in patient LTC? Carolyn, can you answer that question?
I am. Anisha, I would like for you to do a contact us because that could be case specific. We need a little bit more information. If you don't mind, please log into the system, select contact information, contact us, and submit a contact us for your field rep, please. And when you submit that contact us, please include a claim number or a member's ID with date of service, please, so that we can find that claim and research it and assist you better, please.
Thank you, Carolyn. Okay, Kim, Are we required to have a signed waiver on file for 661/662 members in order to bill them if it was a crossover claim? If it was an auto crossover from Medicare, you won't need to have anything to bill the patient. But if you all accepted the patient and without checking to see if they had 661 or 662, you are responsible. But if it's auto crossover from Medicare, you're not responsible.
And for those that may not be aware of what she's speaking of when she says 661 and 662, she's actually talking about the spin downs or slim Bs to where it could either be due to QMB or the member may have to pay a certain amount prior to Medicare. I'm sorry, prior to Medicaid submitting payments over, or it could be due to SLQI1 to where Medicaid is not responsible to pay on those type of claims. Those would be claims where Medicaid just pays the members' premiums for Medicare.
Okay, those are all of the questions that I see in the Q&A panel. Do we have someone else with their hand raised? Let's see. Oh, I think that's still Anisha. I'm gonna go ahead and lower your hand. Okay, ladies, I don't see any more questions and there are no more hands raised, so
Okay.
we can go ahead.
Well, if we have no more questions or comments or even statements, we want to thank you once again for taking out the time to join us for our Medicaid virtual fair. We look forward to seeing you by office visits, on-site visits, additional conference calls and things of that nature, as well as the next Medicaid fair.
Hold one
Thank you.
second, Janie. I'm sorry. We do have one more question from Tamara Booth regarding denial code 6704, Medicare Part B deductible greater than the yearly deductible. What is meant in the earlier slides regarding exceeds value and system decision PRM 1029? Not sure what that means.
That was an error. That's why the new slide that I presented was corrected. So the new wording for that will be uploaded onto Canvas. So please disregard that. That was for internal review.
Thank you, Carolyn. Okay, Janie, I'm sorry. Well,
No
I'm sorry, we
worries.
have one more hand raised. Etna, you can go ahead and unmute yourself. Okay, she took it away, so maybe it was a mistake. I'm going to give you all a couple of more minutes before Janie closes out again.
While we're waiting on hands to be raised, please, please, please create contact us inquiries so that your rep can assist you with your denied claims. Do not sit on those claims. And when you submit those contact us inquiries, please include something for us to review. Do not just say billing issue. Please give us those claim numbers so that we can research those claim numbers for you. And if you know you're only going to be in the office half days, Monday through Friday, please let us know that so that we can better assist you with getting your revenue into that office. Thank you, thank you, thank you.
All right, it looks like we're clear, Janie. You can go ahead and close out.
Okay, well, I won't take as long as I did before, but once again, everyone, thank you so much for attending. Have a wonderful, blessed, and safe day, and we look forward to talking to you again.